Hello everyone, I'm Dr. Shruti Batula, consultant neuro-ophthalmologist and squint surgeon at American Laser Eye Hospitals. Today we'll see our neuro-ophthalmology clinic and we deal with optic nerve disorders. So let's dive into it. So you must be thinking, what is optic nerve and what does it do? So optic nerve is the nerve which connects the brain to the eyeball, and its function includes visual perception, that is the main visual functioning, which includes the clarity of vision and color vision, contrast sensitivity, and the field of vision. So any problems or abnormalities in these functioning, we evaluate in detail and give treatment in the neuro-ophthalmology clinic. So first is headache. So whenever a patient has headache includes a broad spectrum. There are various kinds of headaches, and what kind of headaches if you experience, you have to come to an eye doctor, specifically a neuro-ophthalmologist. Whenever you have a headache associated with nausea, that is a sensation of vomiting, or if you experience a headache along with vomitings, then you have to consider going to an eye doctor. And also when the headache is associated with dizziness, that is a spinning inside your head, or if there is a ringing sensation in your ears, whenever you bend or you lie down, your head feels heavy along with the headache, then you need to meet a neuro-ophthalmologist. Apart from these, if there is headache associated with pain during the eye movements, or there is blurring of vision, or if you see dark spots in your field of vision, then immediately visit a neuro-ophthalmologist. Then Second is double vision. So God has given us two eyes. So this helps us to see a clear 3D image. Whenever the two eyes don't function simultaneously and one eye starts moving in different direction, then we experience double vision. So most common reason double vision occurs is due to the weakness in the eye muscles, which is either caused due to damage to the nerve which supplies the eye muscles, or some abnormality which is occurring inside the brain. So definitely first you have to visit a neuro-ophthalmologist, and we do tests to know what is the exact cause. So different causes include nerve pathology or muscle pathology, or a pathology in the neuromuscular junction that is called as myasthenia gravis. So double vision could be anything. So it needs in detail evaluation and examination in a neuro-ophthalmology clinic. Third is blurring of vision. So the blurring of vision, it could be sudden, painless, or it could be sudden and painful. So the blurring of vision, if it is sudden, it is always a matter of concern, and you have to come to the emergency as soon as possible. So sudden diminution of vision, it could indicate a inflammation or a swelling in the optic nerve. So optic nerve, as we discussed, is the nerve which connects the eyeball to the brain, and any abnormality or pathology in the optic nerve will cause a sudden diminution of vision. This could be either optic neuritis, that is, it is an autoimmune problem, or there could be ischemic optic neuropathy. That means the blood supply to the optic nerves gets impaired, and it's usually seen in old people. And in few cases, any infective or inflammatory causes in the body may affect the optic nerve, causing the sudden diminution of vision. Whatever is the reason, it needs in detail evaluation, and the examination should be as early as possible, and the treatment should start immediately to preserve and restore vision. Fourth is color desaturation. If you feel the colors are little less intense, or example, if you think the apple is not as red as before, or the sky is not as blue, then it indicates something is going on with the optic nerves, and it could be an early sign of an impending damage to the optic nerve. So don't neglect changes in your color vision. And the fifth is dark spots in your field of vision. This is called as scotoma. So whenever you're seeing dark spots or dark areas in the field of vision, that means the whole area of your visual perception is called as the field of vision. And sometimes in one area the visual perception is lost, so that area appears black, or there are few areas with dark spots. So such conditions also indicate that some abnormality is going on with the optic nerve, and you have to visit the eye doctor as soon as possible. And we do various tests to assess the functioning of the optic nerve, and we come to a diagnosis by clinically examining and seeing what actually is the reason behind this, and the treatment is given accordingly. If you have such symptoms, then do not neglect and come to the neuro-ophthalmology clinic as soon as possible. And always remember that diagnosing optic nerve abnormalities as early as possible is very important to get a full recovery in your vision. Thank you.